Yinjun is 5 years old. He has been unable to live happily like other children as he was born deaf. All these years, he has felt lonely and helpless.
我说如果小孩子这样子了以后怎么办？我说这样子他以后就是以后他夜晚半夜难的呀，怎么跟人家沟通？再说这样的小孩子他听不见，他脾气很坏的，你要说什么他一巴掌他就过来了。当时他打我的时候真的很难过。看到人家好好的孩子的时候，就是感觉人家是那么好，我的孩子怎么是这样子？
Cochlear implants are the only possible solution for this boy. Yet this ordinary rural family can't afford the over 100,000 renminbi surgery.
真的吓了一跳，他们说做耳蜗最便宜的也要17万块钱。我们想想，17万块钱对我们这个家来说，简直就是很大的一个概念了，根本就做不起。
His family can do nothing but watch him grow up in a silent world. Since 2011, the new Rural Cooperative Medicare program has provided compensation for serious ailments. Eligible rural families are entitled to compensation of 119,000 renminbi for a cochlear implant surgery. Shortly after Yinjun's parents got the news, they took him to have the surgery. Now Yinjun can hear just like any ordinary child.
一俊，你干什么？
我们一喊他，他马上就听见了。当然我赶紧就高兴了，哪怕他就是你喊他，他回头看了一下，或者哎一下，我们真的好高兴。
一俊。
The new Rural Cooperative Medicare system is a mutual assistance system launched and sponsored by the Chinese central government to help cover the medical expenses of citizens, especially for serious illness, with funds from different sources. Currently, a farmer who chooses to participate in the program is eligible with a contribution of 50 renminbi a year, while the government provides a minimum subsidy of 240 renminbi a year per farmer. The system has changed many people's lives.
现在的唯一的办法就是退休。一开始1个星期是2次，今年呢就要3次。就德国的心脏还是这个报销，不报销，让我找到头买掉了。
GaoKehong, a farmer in He County, Anhui Province, just received hemodialysis. He is having his bill reimbursed by the new rural Medicare service.
你叫什么名字啊？
我叫GaoKehong。
哦，你总共是交了5次哦，延期是吧？对的，按85%报销，现在报了1955。对。哦，好，那我现在发起给你了啊。
啊好。退休一次是486，一个月大概13次，一年呢可能7、8万块钱。现在这个新灯号的报销比例呢是85%。 这个一年下来了3年多了，这个省了5、6万啊。按照医生讲，按他的骨髓走，像我们这个身体状况要好，心情舒畅，那这10年、20年这话。
Every day, there are several patients like GaoKehong who receive dialysis covered by the new rural Medicare system at the He County People's Hospital.
之前 做透析治疗的每年病人也就在3、5个。新兴农村合作医疗制度成立以后呢，每年大约有接近20多个病人到我们这儿来做长期维持性血液透析治疗。这在以前可以说是想都不敢想的。农村病人能做这样的治疗，如果没有新农合的支持，可以讲85%以上，那是看不起的，绝对是放弃的。
10 years ago, most of China's rural inhabitants didn't have access to medical insurance. In 2003, the new rural cooperative Medicare system was implemented across China. In 2008, the number of rural residents covered by this program reached 800 million and increased to 832 million by the end of 2011. Rural residents no longer have to worry about high medical expenses.
原来看不起病人，你比如说像癌症、像尿毒症、像那个白血病这类病人呢，现在也去医院看了。
Little Yating suffers from leukemia. This August, she received a successful stem cell transplant operation and is now recovering. She only needs to pay 10% of the medical fees for leukemia under this program.
国家这个政策还是比较好的，要不然不是我们这一个小孩，好多小孩还有这白血病人，说实话真就好多要放弃。
Sun Zimin, vice president of the Anhui Provincial Hospital and a leukemia specialist, has become very busy lately as more and more leukemia patients come to seek treatment in her hospital.
2000年这种小孩的病人不到10例，那么这个政策以后呢，我们2010年8月份，我们就光是14岁以下的做了16例，去年11年做了34例，那么今年上半年到6月份一共做了18例。
In 2010, China launched a pilot program under the new rural Medicare system to improve medical care for rural children with critical illnesses such as acute leukemia or congenital heart disease. Starting in 2011, uremia and 5 other illnesses began to be covered by the program. In 2012, with lung cancer and another 11 illnesses newly included, the coverage has expanded to 20 critical illnesses and the reimbursement rate has also risen.
我们提高了重大疾病的实际补偿比，就是报销比例，最少提高了70%的报销比例。就是你住多少，你住院花了多少钱，你花了1万块钱，我给你报7000。
By the end of 2011, over 230,000 patients with critical illnesses benefited from the new rural Medicare system. Now, the rural Medicare system and the basic medical insurance programs for urban employees and residents form the framework of a universal Medicare system. By the end of 2011, 95% of the Chinese population had been covered by these programs. On August 30th, 2012, 6 ministries and commissions under the State Council, including the National Development and Reform Commission, jointly issued guidelines for its further enhancement and improvement nationwide. China is establishing a nationwide Medicare network covering the largest population in the world. Apart from improving the basic Medicare system, the Ministry of Health also aims to provide the public with easier access to medical services. Because the allocation of medical resources is unbalanced, large hospitals are often jammed with patients, making satisfactory service difficult to deliver. Developing medical services in communities can largely solve this problem. Through years of efforts by the health authorities, many have benefited from community medical services.
我这身体呀，就像一台老爷车，如果不小心维护啊，说报废就报废了。看吧，这都我吃的药，这是高血压的，这是那个稀释阿司匹林，稀释血液的，这是也治冠心病的。
Liu Shaoying is 74 years old. He lives in a traditional courtyard house on GaoKehong Street in Beijing. He has been diagnosed with 8 diseases and has to take 17 kinds of medicine every day. In order to avoid mixing them up, Liu Shaoying has drawn himself a list of all his medications, with notes of names, dosages, and frequencies. A few years ago, trying to see a doctor in a large hospital was always torturous.
烦的，每个月你得去好几次啊，那简直到那我站不住，都我们老伴跟着去。 是吧？我在灶地上带着凳子，我旁边坐着，他就给排队去。那一站3-2小时在那等着，那哪受得了啊？受不了那是。
Liu Shaoying struggled like this for many years. It was not until 2005 that his situation began to change. The Chinese government began improvement of primary healthcare services in 2005. Community healthcare reform was launched in Beijing, and Desheng Hospital, located in Mr. Liu's neighborhood, was transformed into a community healthcare center intended for nearby residents. The clinic is a few steps away from his home, and there is no need to wait in long lines. Seeing a doctor is much easier now and costs much less.
这给我统计一下，就这6种都是自费的。要如果在3级医院的那个拿呢，这个都是10%的自费。在这社区医院了跟他订了协议以后呢，就是全100%都报了。我算了算，加起来一共是92.1块，这是1个月的少花这些个钱。要是在大医院还得拿92块钱。
Instead of seeing a doctor in a large hospital, he only needs to take medicine for his chronic diseases, and he can get them conveniently at the community health care center nearby.
又省事儿，又省力，又省钱，何乐而不为？你说吧。
The community health care center provides basic medical services for patients with common, frequently occurring, and chronic diseases, and other public health services such as disease control and prevention. This has greatly eased patient pressure in large hospitals.
最常见的一些疾病，像慢性病、糖尿病、冠心病、脑血管病、高血压，像骨关节病等等，这些都是属于我们的诊治范围。
Han Chengcheng, director of Desheng Community Healthcare Center, works with her 197 colleagues to serve the 120,000 community residents.
我们有43名全科医生，55名社区护士，60名防保人员。这3位人员是社区卫生服务中心的主要技术力量。
Different from medical specialists in large hospitals, most doctors here are general practitioners who know their patients very well and provide outpatient service for common diseases, frequently occurring diseases, and common emergency cases. They help patients better understand health. The Community Healthcare Center is attracting more and more local patients, one of whom is Liu Jianping.
原来也是对社区医院不太了解哈，有病都上大医院挂专家，都是这种。有一次我是想，反正血压不太好，拿点药到这儿来吧，给开点药吃吃还管事儿。社区医院也不错，感觉。
请284号牛建平到3诊室就诊。
Liu Jianping is also attracted by the center's regular health management for patients. She has signed a health management agreement with Desheng Community Healthcare Center, which created a special file for her. She was also allowed to choose her own doctor to provide her with one-on-one family doctor service, in addition to basic health services.
挺受益的，3个月以后呢，血压就挺好的了，就是达到了一个，就是说没吃药，就及时把它控制住了。
Dr. Fan Li is Liu Jianping's doctor. Liu has been treated by Dr. Fan for her chronic diseases, and her condition has improved. They have maintained a great relationship.
合格的一个医生不仅是他的朋友，是他的健康的守门人，也是他的费用的守门人。他会让他特合理的消费，特理性的消费。我们的病人都有一种特殊的那种情感的那种沟通和问候。
It took Desheng Community Healthcare Center 3 years to establish health files for nearly 100,000 residents. This has ensured better health management for the residents.
这个档案里边包括个人的一些基本信息，包括病人的一些健康信息都可以体现出来。那么这个病人曾经在哪一年在这儿就诊？他有高血压，有糖尿病，有慢性支气管炎，曾经是在什么时间段进行了诊断和治疗的，都有历史的记录。这样对病人今后病情的分析、健康问题的分析是非常重要的。
On July 19th, when Liu Shaoying revisited the community health care center, his doctor happened to be off duty. The doctor on duty treated him soon after he checked his file.
那个尿啊，有点起泡。起泡，起泡是不是就是蛋白的？不是，
那没关系的，好吧。然后咱们还就是饮食尽量饮食清淡一点，少油。
The progress and reform of China's healthcare system and improvement of community healthcare service has enabled residents to have minor illnesses treated at community healthcare centers, serious illnesses treated at hospitals, and rehabilitation back at community healthcare centers. Improving community health service is fundamental to nationwide access to primary health care. In 2010, outpatient visits to primary health care centers in Beijing reached 60 million, 10 times that of 2006. Patients visiting community health care centers has increased from 5% in 2006 to 42% this year, greatly reducing the burden on large hospitals.
我们现在的门诊量现在已经超过2级医疗机构的门诊量，每天可以达到800-900人，包括中心和社区站，表明什么？表明首先病人对我们的诊治能力和水平是信任的。
Over the past 3 years, the Chinese government has invested 4.15 billion RMB in 2,382 community healthcare centers in urban areas, and 43 billion RMB in healthcare institutions in counties, towns, and villages. These efforts have greatly improved China's basic healthcare and public healthcare service system. The basic health service system provides all citizens in urban or rural areas with 10 types of public health services, including health file management, education, vaccination, as well as health management for children 6 years old and under, expectant mothers, the elderly, patients with hypertension and type 2 diabetes, as well as serious mental diseases. They also act to report and inform the public of outbreaks of infectious diseases and public health emergencies. In addition, major public health service projects targeted at priority groups like children and women or at specific diseases or regions have been carried out to ensure healthy living and prevent poverty caused by disease. Yuefang, a physician at the Nandan County Maternal and Child Hospital, Guangxi Autonomous Region, once participated in a rescue operation. February 8, 2006. Miss Ye from the Yao ethnic group had a difficult birth at home in Yaoli village of Nandan County. Dr. Wu and some of her colleagues were immediately dispatched on a rescue mission. However, their ambulance couldn't drive up the narrow mountain road to Miss Ye's home, which normally takes over an hour to walk. So the medical team had to run.
那个脸在上面，不然应该是这种鼓下来的吧？他这样脸在上面就摸到鼻子了，所以就很难受了，就鼻子朝上的。
Upon discovering the cause of her difficult labor, Dr. Wu immediately decided to send Miss Ye to the county hospital. The medical team had to carry Miss Ye on a stretcher to get to the ambulance over the rugged road. In some remote mountainous areas of Guangxi and across China, it has become a tradition for pregnant women to give birth at home, due to the inconvenient distance, limited budget, and influence of conventional norms. But poor delivery and sanitary conditions are often deadly for both mothers and newborns.
广西原来的孕产妇死亡率是排在第3的，全国。专家做过调查，1/3死在家中分娩，1/3死在转诊的路途当中，还有1/3即使到了医院，来不及抢救死亡的。
Chun-Li Li, director of the Maternal and Child Health Division of Guangxi Regional Bureau of Health, has been dedicated to reducing maternal and infant mortality for years.
那个孕产妇死亡，1995年那是10万分之238，最高的现在达到了10万分之500多，那个相当的高。那住院分娩率呢，只有18%。
In 2000, the government established projects with special funds to reduce the maternal mortality rate and eliminate neonatal tetanus, providing financial support for women of high-risk pregnancy and encouraging expectant mothers to give birth in hospital. In order to encourage expectant mothers to give birth in hospital, the Guangxi government has provided funds for special stretchers in 4,800 rural clinics and purchased more than 100 ambulances.
2006年，我们的住院分娩率就达到了64%，2011年底呢是94%，今年是99%。
Since 2003, investment in maternal mortality reduction and neonatal tetanus elimination in Guangxi has amounted to 1.2 billion RMB, with over 3 million pregnant women helped and saved.
我们用这个专项资金呢，让我们的这个高危的孕产妇得到救治，还有更重要的，让所有的妇女都享受到这个健康资金的服务。
The healthcare infrastructure in Guangxi has been greatly improved. Community hospitals are well equipped for delivery, and expectant mothers can get help in time. At the same time, obstetricians have improved their skills from the on-site annual training sessions.
从2005年开始，我们已经派了500多副高以上的产科大夫去，一直到县乡驻县蹲点，手把手的带教基层的人员。
To protect maternal and infant health, programs to reduce maternal mortality and neonatal tetanus have been carried out in 2,297 counties of 22 provinces in central and western China, covering approximately 830 million people. Since 2009, the central government has allocated about 3 billion RMB a year for hospital delivery subsidies in rural areas across the nation, covering a total of 27.27 million expectant mothers. In recent years, the Chinese government has also been promoting capacity building in health emergency management and handling to prevent and reduce the incidence of public health emergencies and control the risk of emergencies to public health. On May 11, 2012, the largest emergency response exercise since the establishment of the PRC took place in Jiezi Town, Chongzhou, Sichuan. A new team has caught widespread attention. It is the National Emergency Medical Rescue Team founded by Sichuan Provincial Bureau of Health. Established less than 1 year ago, the team is already participating in drills.
我们从事的是应急医学救援的工作。当灾难以后，医疗机构的严重毁损，它不能行使当地的医疗救治工作和医学救援工作的时候，我们这个医疗队就作为一个补充和替代，来行使这一类工作。
Since 2010, over 20 national medical emergency response teams targeted at different regions and areas of expertise were created to cope with emergencies such as outbreaks of acute infectious diseases, natural disasters and accidents, acute poisonings, and nuclear and radiation accidents. Lessons have been learned from the widespread impact of SARS in 2003.
它导致的危害主要就是一个呼吸衰竭，传染性是非常强的。 好像一接触似乎都会感染。相当一部分人受影响的是医务人员。
Liang Zong'an, chief physician at the Department of Respiratory and Critical Care Medicine of West China Hospital, Sichuan University, served in 2003 as deputy head of the SARS Clinical Treatment Specialist Team in Sichuan Province.
SARS 之前，我们国家的传染病防控，一般流感的话呢，就是由疾控中心做一些监测。那么真正的医院内接触到呼吸道传染病的，相对来说就比较少了。包括住院的这个流程，都已经大家都忘记了。相应的设施要么没有，要么就闲置在那儿没用。
The outbreak of SARS left China with 5,327 infections and 349 deaths. Both the government and medical workers learned from the impact of SARS that China lacked effective mechanisms for prevention and control of new epidemics and for public health emergency response. More efforts were made in building infectious disease hospitals and improving preparedness and response systems for health emergencies with specialized teams and regulations.
从国家到地方，卫生行政部门专门成立了卫生应急办。我们非典以后就成立了12个应急队，从人员这个队伍建设来讲，给加强。
After the outbreak of SARS, the Chinese government began to strengthen its capacity for disease control and public health emergency response. In 2004, an online reporting system for infectious disease and emergencies was established, covering different levels of government from townships to the central government. It has enabled a reporting of infectious diseases and public health emergencies to the Ministry of Health within 24 hours for further action. The system greatly aided the relief efforts for the Wenchuan earthquake.
汶川地震以后，直报系统都被摧毁，特种灾区就实行了用手机短报。2周以后啊，计算机工作的恢复，又重新实现了传染病的网络报告制度啊，网络直报啊，为灾后无大狱这个奇迹的创造是做出了很大贡献。
After the 2008 Wenchuan earthquake, China's public health emergency response system was further consolidated. When the H1N1 influenza broke out in 2009, China's health authorities were ready to make a quick response. Du Li, head nurse of the Sichuan Emergency Medical Center, still remembers what happened 3 years ago.
当时美国、欧洲这些国家呢 ，H1N1 都在蔓延，所以说我们国内呢也非常重视。
One patient in the clinic caught Du Li's attention.
这个病人是从那个美国回来的，体温是38度3。
Du Li combated SARS back in 2003. Professional experience told her that this patient could have H1N1.
因为我们有处理 H1N1 的预案，就是发现这个病人是来自疫区，然后就层层汇报，对这个病人进行隔离。
Soon the case was put through the reporting system for infectious disease and emergency to Sichuan Provincial Bureau of Health. Then the battle against H1N1 began. Following laboratory testing analysis at Sichuan Disease Control Center and review by the National Disease Control Center, it was confirmed to be the first case of H1N1 in China. The Chengdu municipal government held an emergency press conference and reported this H1N1 case to the public.
"很多预案啊、机制啊、队伍在5.12以后又有大的提升，所以全国 H1N1 流行控制得很好。
effective emergency medical rescues carried out by China's health authorities during the 2010 Yushu earthquake and 2020 Zhouqu landslide successfully minimized the casualty rate. Health security was also provided for the Beijing Olympics and World Expo Shanghai. While consolidating the emergency response system, the Chinese government takes effective approaches to control the epidemics and endemics that threaten people's health. By the end of 2010, the total number of HIV-positive and HIV/AIDS patients was around 760,000, lower than the targeted 1.5 million. The nationwide tuberculosis rate was reduced to 0.66%, meeting the Millennium Development Goals ahead of schedule. And the number of schistosomiasis patients was about 326,000, a 61.3% reduction from 2004. From 2007, the vaccine categories under the National Immunization Program increased from 6 to 14, while the diseases protect against increased from 7 to 15. And the program coverage has expanded to adults. These combined efforts have lowered the incident rate of infectious diseases. Currently, iodine deficiency has been eliminated, with Kashin-Beck disease, Cushan disease, and fluorosis have been controlled, with the number of victims remarkably decreased. By defining basic health care as a public good that all citizens are entitled to, the Chinese government is committed to ensuring every citizen enjoys basic health care. The average life expectancy of the Chinese people has risen from 68.6 in 1990 to 74.8 in 2010. From 1991 to 2011, maternal mortality decreased to 0.26%. Infant mortality was down to 12.1%, and the mortality rate of children below the age of 5 decreased to 15.6%. By the end of 2011, the number of healthcare institutions in China reached 954,000, including 22,000 hospitals and 918,000 local healthcare facilities. For every 100,000 people, there were 381 hospital beds, 182 physicians and assistant physicians, and 166 registered nurses. For every million people, there were 473 professional healthcare providers. From 2002 to 2011, the number of patient visits rose from 2.14 billion to 6.27 billion, while the number of inpatients increased from 60 million to 150 million. In 2011, the proportion of hospitalized patients was 11.3%, and utilization rate of hospital beds was 88.5%. Moreover, 83.3% of urban patients and 80.8% of rural patients could get to a hospital within 15 minutes. To further improve public health in China, promotion campaigns have been carried out by health authorities. As a result, 153 cities, 32 districts, and 456 towns have been listed as national health and sanitation models, with 72.1% and 69.2% rural residents have access to tap water and toilets, respectively. China's health authorities are working to save more lives in disasters, helping mothers to deliver safely and children to grow up healthily, and improving the well-being of every single person. China's basic healthcare system will continue to be improved and consolidated in the years to come, ensuring more secured health for the Chinese people.